Thank you for those who have been hanging out here all day. So we're going to talk a little bit about using essential oils to enhance other modalities. Now, the other modalities that I use in my practice are chiropractic, acupuncture, and healing touch. And so little disclaimer here, but one of the questions that may be asked is, why would we want to use essential oils with chiropractic and acupuncture? And I'll get into that here in just a little bit, but I have to have kind of a little funny ha-ha here. This is the kind of stuff that really makes me question Western medicine. So I think when we get into integrative medicine, when we start looking at more holistic options, sometimes we get kind of fed up with what's happening in the Western world, right? I know that's kind of where I went, and I started looking for other answers. When I started taking the right-hand turn, I was in a very traditional practice, hogs and dogs, and then I brought horses to the practice. And then in the late 90s, pseudorabies came through and wiped out 25% of my practice. So it kind of opened the door for me to go back to school. My dad always said I was a professional student. I have yet to prove him wrong. And I went back to chiropractic training, acupuncture, and then the herbs and oils and nutrition kind of came along with that. So now today in my practice, this is kind of what you're going to see. And my practice does not smell like a traditional practice, and I definitely get a lot of looks when we get the moxa out. Anybody else? Yeah. And so, like I said, this is a little bit different. My clients are like, you aren't going to retire anytime soon, are you? It's like, yeah, no, I don't know who else could come and do what I do in this little part of a cornfield in central Illinois, so there's no signs of retirement yet in my future. So I want to talk a little bit about animal chiropractic. Who does animal chiropractic here? Excellent. Okay. Alrighty. So I know when I went back to school, the reason I went back to school for chiropractic, a classmate of mine she went down that road. And I'm like, yeah, okay, whatever. And then she came through and she actually adjusted my horse. And the difference that I saw in my horse afterwards, I was kind of like, okay. Then I started having her come and work on some of my clients' horses. And it was amazing what we saw. And then when I fell off a horse in competition in 1996 in Shelbyville, Tennessee, I didn't know if I was going to be able to kind of live to tell about it. And I thought, well, if chiropractic helps the animals, I'm going to see what it does for me. I experienced the benefit, and it's like, okay, I'm going to go learn this. So that's how I started. But when I went back to when I went back to school for that, I have to admit, going through vet school, okay, it's a bone, it belongs in the spine, okay, but I couldn't have told you, was it a lumbar vertebrae, was it a thoracic or a cervical vertebrae? So kind of had to learn it all over again from a different perspective. So, chiropractic, this is a big, long definition of it, but the word chiropractic comes from the Greek meaning to perform with the hands, and the focus is the neuromusculoskeletal system, on the relationship between that. And why? Because the nerves, as we know, control everything. And the goal of the chiropractic is to restore function and mobility, restore nerve transmission, and help the individual achieve their optimal potential and heal from within. Our bodies and our animals' bodies have an innate ability. They want to be in homeostasis. And so sometimes when we give them that little nudge, if you will, it's gonna help them. And that's the thing we do with nutrition and herbs, give those bodies the basic building blocks it needs so they can help heal themselves. So this is just a picture of me working on a border collie, and Beyonce, the dairy cow. She was a pretty famous show cow in my neck of the woods. And this chiropractic is where I finally found out why I had to take all that physics in high school and suffer through it again in college. Force equals mass times acceleration. And I have enough mass behind myself and I can be fast. So that's how we can adjust when you get the question, how can you adjust a horse? How can you adjust a cow? How does a 100-pound chiropractor adjust a 300-pound person? Okay, it all comes down to the physics on that. So with chiropractic, we deal with subluxations, some of the causes of subluxations in the skeletal system: trauma, toxins, stress, and emotions. And from the musculoskeletal standpoint, we're looking at the muscles, the tendons and ligaments, the joints and discs. And again, this is some place where I had to use a little bit of geometry too when we go back to learn about this, because you have to learn the angles of the facets and understand where you're putting the pressure or the force to make the correction. And then with chiropractic then too, we're dealing with the nervous system. We're helping balance the parasympathetic and the sympathetic system so that, again, we are the way we're meant to be. And when we're doing this, when we're doing chiropractic on animals, I mean, my big preference is not to sedate. I need to have those muscles, tendons, and ligaments, and those nerves. I need to have them talking to me through my fingers so that I know, what to do and how to help them. So essential oils are great to be used prior to an adjustment. When we have a horse that's hauled in for an adjustment, I remember I had a gal bring me her 3-year-old Futurity barrel racing prospect, and the horse had not been away from home very often, and this horse was just literally outside of her body. And there wasn't any way I was going to be able to really get working with her until we got her calmed down and brought back together. So that's where I started using essential oils on the pole and just doing some other things with the essential oils. And finally, the horse just kind of came back around, and we were able to do an adjustment. I also like to tell the story. I had another client who had a barrel racing stud, and he was very popular in the area. He produced a lot of good running horses in the area, but he needed to be adjusted a lot, and it was always a battle. I felt beat up after every time I would adjust him, because he would just constantly be picking at me, and my assistant would be trying to keep him off me, keep him from biting me, that type of thing. And one day I asked him, I said, "Can I use some oils on him?" And he said, "Yeah." And I said, "Okay." So I chose some oils, put them around the coronary band and down his cannon, all 4 legs. And when the owner came back around the corner, the stud was sitting there with his ears off to the side. He was showing his wares quite well. And he was just standing. He got the best adjustment, and I didn't get beat up. And the owner came around the corner and saw him like that. And he goes, "If I hadn't seen that, you just turned my stud into a gelding." And I said, "Yes, I did." And it's going to happen again. So that's a good place to use the essential oils, because again, from a chiropractic perspective, the adjustment is going to depend, as we know, on the relaxation of the patient as well as the relaxation of the adjuster. So that's a good place to start with the oil. So a lot of times I do give owners oil homework at home, and hopefully they pay attention, because there is a quiz when they come see me, and I'm like, "Okay, where are we doing with the oils?" And they're like, "Oh, yeah." So we have to talk about that. So most of my patients are receiving chiropractic care due to decreased athletic performance. Maybe they have an injury, maybe they're an older individual that's having some discomfort and pain, maybe age-related. So these are some of the essential oils that I find very helpful in practice. Copaiba, I've talked about for inflammation and pain. Wintergreen, peppermint, all along that category. Lavender, very relaxing. It also has some anti-inflammatory properties and can be good for pain as well. Marjoram mussels, remember MM. Lemongrass ligaments, okay, LL, and tendon damage. Grand fir, may also know it as Idaho balsam fir for bone and joint pain. A lot of the tree oils are really good for musculoskeletal issues. You think of that tree, kind of reminds you of a bone, right? Then the tree is like the structure of the plant. So anything bone related, a lot of times I use a lot of tree oils. Helichrysum, really, really good for tissue regeneration and nerve pain, and myrrh also for that tissue regeneration. From an emotional standpoint, and again, a lot of times what we see in the body can have an underlying emotional component that after a while manifests itself physically. So we might look at some of these oils for an emotional perspective to help get everything back in balance. I love the citrus oils for that. We diffuse a lot of the citrus oils in my practice. And then these are some of the other oils that I use quite frequently. And let's see here. Okay. Copaiba, again, very high in beta-caryophyllene and alpha-humulene, which is anti-inflammatory. Wintergreen is 90+% methyl salicylate, so that's your anti-inflammatory and analgesic actions. And just be sure that we've got, if you're using wintergreen, it's good quality wintergreen. Wintergreen is very adulterated out there on the market. If you see something that says 100% methyl salicylate, put it down and walk away, because it's probably not, there's some synthetics in there somewhere. And again, marjoram for muscles, balsam fir supports bone health, and I think we covered all that. So, okay. So one of the oil blends that I use a lot for chiropractic care is Chiropractor in a Bottle, and it's a blend of black spruce, blue tansy, camphorwood, geranium, frankincense. The company did have to change the formula because it was originally the one on the bottom. They now have a sustainable source of rosewood. So black spruce, blue tansy, frankincense, and rosewood. So there's a couple different formulas for that out there. But I use it on, dogs, cats, rabbits. Yes, I've adjusted rabbits, sheep and goats, alpacas, pigs, cows. I have some clients that have show pigs, and I adjust their pigs before a fair on that, and I send them home with the Chiropractor in a Bottle oil. I should have I have a video of adjusting a pig, but that one didn't make the presentation. I'll remember that for next time. But a lot of times I'll allow the animal to smell the bottle, and then I'll apply it from the back of the head down to the tail. And so again, that might just be on my hands, rubbed together, and then just go down through. A lot of times I may be feeling the energy field along with that too. For a cat, this might mean a drop on my fingertips, literally a drop, and that's it. And then put it on them as well. Small dogs may get 2 to 3 drops, a large dog 3 to 4 drops, and a horse maybe 5 to 7 drops. Again, this isn't something that I really use at a drop per pound size. Just the way the essential oils work in the body, it's not cookbook. It's not cookbook, and it's amazing how much benefit we can get from a small amount of oil, even if it's diluted, okay? This blend was formulated to support courage and confidence while physically balancing the animal's chakras, and support, like I said, I like to say it supports them structurally and energetically as well. So best practice for me is for the owner to apply it on a regular basis, and especially before they bring the animal in. And if they forget, okay, I have some, don't leave home without it, and I'll apply it like we talked about. And sometimes I'll actually apply it before I do acupuncture as well. And I have even been known to dip my acupuncture needles in it before I insert the needle into a point. This is one of my favorite areas for essential oil application. It's right behind the metacarpal or maybe even the metatarsal pad. You'll see some information out there where it talks about applying the oils to the pads of the feet. I am not a fan of that. Now, some people do it and they get along just fine. If it works for them, that's great. If it ain't broke, don't fix it. But I just have seen too many issues, even going in between the toes, because where our pets walk, that's what contacts the floor. And anything that's toxic out there in our world, that's where they're going to accumulate it. And then again, the oils are going to try and get rid of that. So this little place, your thumb fits right there. It's beautiful for a place to apply the oils. And again, it might be, I put the oil in my palm of my hand, pick it up, and then I just put my finger there, maybe my thumb if it's a bigger dog. And you can do it similarly between the bulbs of the heel on a horse as well. And the coronary band for application of oils in the horse is great. We're hitting all kinds of ting points there, and it's just a great place. Again, worked like a charm on that barrel racing stud. The other thing I do in practice is acupuncture. And so, who does acupuncture here? Oh man, all right, very good. So we know what we're affecting with acupuncture, we're restoring that normal chi, the energy flow through the meridians. And these acupuncture points are areas that have a lot of high density nerve endings, lowered electrical resistance, increased electrical conductivity. And I think it's just really interesting that, when Western medicine finally figured this out, that, hey, this maybe, Western medicine has to know why it works. And, when all this was figured out years and years ago, they didn't have all the testing that we have available now. So, same points, same results, two different views or beliefs in how it works, but the bottom line is it works. So while acupuncture is mostly used for musculoskeletal issues in the United States, there are still a wide variety of indications, and the combined treatment of acupuncture and essential oils can have really, really, really synergistic effects. The vibrational energy of the essential oils enhances that energetic stimulation at those acupuncture points. And those chemical components of some of the essential oils help support that a specific physiological function or organ function or even an emotional aspect. So I mean, this is one of the reasons why, why would you want to use essential oils with acupuncture or chiropractic? I mean, that moment you do the adjustment and restore that subluxation, that's just going to draw the oil in even more. When you put a needle in, if you ever felt that needle just like suck in almost on its own, then again, that's what the essential oils can help with that as well. So acupuncture, just some of the different modalities: conventional dry needle, electroacupuncture, hemoacupuncture. So everybody here is probably pretty familiar with all that. Sometimes people will use DMSO with some of the acupressure points. I'm not a fan of DMSO. I just don't like the smell, but I can't say I've never used it. But that is also an option. And then of course the gold bead implants. So using essential oils with acupuncture, again, if we can diffuse in the area to help relax that patient, again, we're going to get better results. And sometimes I will put the oil on the acupressure point before I insert the needle. Sometimes I do it after I pull out the needle. And a lot of times I'm going to send the client home with some directions of where to put the oils on some of the points that we've treated. So that's just again, I think involving the owners with the, whoops, hang on. I think I went backwards, sorry. I think involving the owners, in the healthcare of their pets makes a huge difference on that. So for animals with sore backs, I may dip that needle into that proprietary blend and then treat byway, maybe select bladder points, possibly bladder 23, that kidney association point, and maybe some other trigger points. As Copaiba is that major anti-inflammatory oil, I like to use it at bladder 60, aspirin point, and bladder 40, and master point for back and hips. Again, easy places to show people how to do that at home. Copaiba applied to liver 3 can help dogs with hip dysplasia, and you might consider peppermint oil at PC6 or stomach 36 for animals with GI issues. Juniper, geranium, or German chamomile can be used at bladder 18, 19, and on the liver meridian to help support liver function. I don't know what happened to my thing here. Okay, so again, just some other essential oils listed here to go with some of the acupuncture or acupressure points. For GI, peppermint, ginger, copaiba, lavender. Liver support, juniper and helichrysum. Renal support, I love geranium, juniper, helichrysum. The other one that I should have put on the list too is lemongrass. Lemongrass is another good one that I like to use, especially at bladder 23. And just a reminder, spleen 6 is a junction point for the liver, spleen, and kidney meridians. Based on principles of traditional Chinese medicine, this acupuncture point can help strengthen the spleen, restoring balance to the yin and to the blood, liver, and kidneys. So this little girl was paralyzed, and we did acupuncture and essential oils and got her mobility back. So this was a fun one. And some other oils for back and joint pain. Again, I talked about that before, the copaiba, balsam fir, and some of my favorite points for that. Muscles, bladder 20, and the oil, muscle marjoram, remember that. Lemongrass ligament, gallbladder 34. For nerve damage, helichrysum, frankincense at gallbladder 39 can be very helpful with that. Just a reminder, bladder 23, the back shoe point to tonify kidneys, which cover the bone. Bladder 40, command point for low back. Again, we talked about bladder 60 as the aspirin point. So again, we've got all those wonderful points. Gallbladder 34 moves the liver chi, benefits the ligaments. Gallbladder 39, influential for marrow and the CNS. And always consider, local points for neck pain. Large intestine 4, bladder 11 can be helpful for that as well. So again, putting the oils on before, during, or after your acupuncture treatments can be very, very, very helpful. And my favorite homework for the pet parents. Another point that I really like to use is Anshan. And so where that is, large depression behind the ear, the base of the ear, it's a very calming point. And sometimes if we've got, a nervous dog or a cat that's having, trying to have a meltdown, I'm going to put some oil on my fingertips and then just be, while I'm talking to the owner, maybe getting some history, I'm going to be massaging those points to try and get them calmed down. And so we have a better visit on that. So these are, so we have a lot of acupuncturists in here, yay. So just kind of a review for some of my commonly used extremity points. Large intestine 4, pericardium 7, heart 7 on that. I love heart 7, especially for some emotional issues. So if we've got some animals, I will show the owners what oils I want to put in that area and send it home with them. And so here's just another picture of that on the horses. The little yellow dot down there, I saw this after, that's a dandelion. That's not really trying to show any kind of an acupuncture point on that. So, and I believe you have these pictures in the proceedings notes as well. So, here, I'm sorry. So here's, oh, no, okay, all right. They didn't make it in there. So again, this is another picture here, so feel free to take pictures if anyone needs me to go back for you to take more pictures. I'm happy to do that. So that area of oil application and PC6. Okay. And then again, just showing, heart 7, large intestine 4, PC6 again on that. So one of my other, favorite points here is bladder 23, and this is kind of the description that I give the people that I work with. Find that widest point where the rib curves out the widest and then just goes straight up to the spine. Bladder 23 between lumbar 2 and 3 vertebrae, so there you go. And it's pretty easy to find. This is kind of a skinny horse picture, but I use it to show the point there. And then we've got the naked cat to show that point. And once an owner feels it, it's as we know, it's pretty easy to find. And then here is the point on a little Frenchie. So again, for renal disease, juniper, geranium, lemongrass can be really good oils to use for those areas. Another favorite point of mine is Shangen. And again, when we have some of these animals come to us we're more in a hospice type setting, and we want to try and help those animals eat. Good place for that. Oils that I like to use, and I don't necessarily put the oil on that spot, but I might just rub a little bit on my finger and then just have a little bit on my finger, is orange or spearmint oil. And you can also diffuse those oils in the area where the pet is going to eat. I don't recommend putting the diffuser right over the food bowl, but if we've got some poor appetite issues, start diffusing a couple of hours before you feed them on that. And so that's a couple of oils, orange or spearmint. Another point that I like to show owners to use, especially for urinary incontinence, is CV3. And this is kind of the description of where that point is. So there's some really good oils that can help with the hormonal aspects that may be going along with the urinary incontinence. And I'll also use this point for bladder infections too, just because it's kind of easy for the owners to get to. Some of the oils that I might use here, clary sage for balancing the female hormones. It also has a regulating activity in the pituitary gland, which is helpful for the hormone balance. Blue spruce is going to be helpful for balancing male hormones, and also it's great for emotional support. Fennel has some phytoestrogen activity and also stimulates the circulatory system. And myrrh is another one just because it has great anti-inflammatory actions as well. Another way to look at using the essential oils is from the traditional Chinese medicine principles that we're going to be looking at. So we want to move qi, support blood in the organs, balance yin and yang. And so we've got the 5-element theory. So there's some good information out there on 5 elements, and then your acupuncture, acupressure meridian charts. And so when we use essential oils based on their TCM properties, this is a great way, again, to help you choose an appropriate oil. I know Jeffrey Ewan did talk here at the 2014 AHVMA conference. We can get a hold of those proceedings. That's got a really good information in that. And then there's also Materia Medica of essential oils based on Chinese medical perspective from him as well. So that's something you might try and get a copy of to learn a little bit more about that. I wanted to run through a few other oils and points. Hyssop oil is a shrub that's historically used for expectorant and cough suppression. You may see some caution in animals with uncontrolled seizures. Now again, it's been my experience that I've used hyssop oil in many animals, some of which have had a history of seizures, but I think the problem comes in is when you use too much, or we use too much and maybe the animal, we don't know it has a history of seizures, or they're uncontrolled on that. But hyssop clears the lung heat and tonifies lung qi, and it can be used on the acupuncture point lung 9 for its mucolytic effect and to expel phlegm in a patient with respiratory congestion. Another place I like to use this oil is in, I just lost it, is in dogs with laryngeal paralysis. I found this very helpful in dogs with laryngeal paralysis when they're kind of coughing and gagging, especially when they're trying to eat or they get really, really excited. I've had that really help calm them down. Pine oil, eucalyptus oil, spruce oil, and some associated points here. Spruce oil helps diffuse and mobilize lung qi, and we like to use the shu points and the mu points on that too. And again, just kind of some definitions there of what the shu points are. Mu points are located at the chest and abdomen, also known as alarm points, and they're usually close to the organ associated with the point, and these points may be tender or sensitive to the touch. And so maybe I don't want to maybe put a needle in there, but I might use a little pressure and one of the essential oils. The back shu points are located parallel to the vertebrae and usually located on the urinary bladder meridian, and they're usually about the same plane, the same horizontal plane as that of the related organs. So again, that back shu point of the kidney is on the same level of the back as the kidney. So pine, eucalyptus, and spruce oil are something that can be helpful. And again, I've said before, those oils that are high in 1,8-cineol, like eucalyptus, really support the immune system. And there's different types of eucalyptus, radiata, citriodora, globulus, and they can, again, expel wind heat, treat wind cold, and there's some blends out there that have several different eucalyptus in it, and that's going to help balance the lung qi. Neroli, again, this neroli oil, this is usually an absolute, and so I usually don't use absolutes internally, but they're fabulous, and especially for the emotions, calming the shen, the mind, tonifying the spleen, nourish liver blood, support heart qi. CV14 is a good point, and again, it's something that you can treat excess or deficient heart qi with the neroli. Bergamot, remember, this is a citrus oil that is photosensitive, so be aware of that. But it's good at dispelling pathogenic factors, treating bladder inflammation, breaking up bladder stones. Bladder 27 is a great point for that. Basil oil also can help treat bladder weakness and incontinence too. And I remember one of my first cases when I was learning chiropractic was another paralyzed dachshund. And I was out of town when it happened, and she went in for x-rays to a neighboring practice, and oh look, she also had bladder stones. Well, I sent her up to a colleague of mine And she stayed there for 3 weeks, and she was worked on there. And then when she came, I went up and picked her up, came back. I didn't know anything about acupuncture at that point. And so my friend, Dr. Rykoff, gave me her description of the points, and so I'm just using the points. And then we re-x-rayed the dog later on during her recovery, and there were no bladder stones, and we did not treat her for them. So it was pretty amazing. But we were using essential oils then too. And again, this was early on, and I was still just learning a little bit about that. I skipped that. Oh yeah, juniper. Okay, juniper. Kidney stagnation, wind, damp, cold bee obstruction, good for low back, sacrum pain. Gallbladder 25 is a good point on that. Yeah, that's a picture of gin and tonic there. So does gin help reduce back pain? I don't know, but it is kind of a favorite. It is kind of a favorite of mine. So I have to maybe do some more research on that. For kidney health, again, I talk about geranium and kidney 3, bladder 23. Other oils, juniper, lemongrass can also be used too. Remember, lemongrass has a high aldehyde content, so you may want to dilute that one as well. And some of these chronic kidney disease cats, I like to do B12 acupuncture and bladder 23, and I'll send home some oils for the owners to apply in that area as well. So if we're talking about the liver, we want to address liver qi, lavender, lemon, and rosemary. And rosemary can be very young, so we might need that to help adjust what's going on with the liver. So we know that. And if we got an angry dog with inflamed skin, dry coat, all indicating some liver issues, we might look at using some of these oils with that too. This is a great formula that I use a lot in practice for those dogs that have ACL issues. And if surgery isn't an option, obviously we talk about surgery. I don't do that surgery. That's a referral surgery for me. But we can use this formula along with like prolotherapy, therapeutic laser, PEMF treatments, chiropractic. I use a lot of standard process products as well, joint supplements, adequate injections. But I love this formula for topical application on the stifles. Now sometimes I might have to dilute it, add some carrier oil to it because of the lemongrass. We just have to see how the individual responds to it. But another thing I've added to this formula, that I've been adding to the formula for added benefit, is 5 to 10 drops of sandalwood. So I found that to be very helpful too. So when it comes to the GI, ginger, cardamom, peppermint, fennel, there is a study that was done with a combination of ginger, spearmint, peppermint, and cardamom that really showed just by smelling it how much it relieved the nausea, postoperative nausea. So a couple good points for that, stomach 36, PC 6. So when we're talking about different bodywork techniques, like with massage or lymphatic drainage, these are, again, some of the oils that can be very, very helpful with that. So my favorite, I think I talked about it earlier, is I like to do tangerine and cypress, like 50-50 for edema. And we get those lymphatics moving. You might do 50-50 tangerine, cypress, and add a carrier oil into it, and then do some massage with that too. Homeopathy, I say right up front, I am not trained in homeopathy, so I will defer to my colleagues on this. I've been told multiple things by different colleagues, but kind of the bottom line is the general consensus is that the mint family should be avoided. So somebody enlighten me or tell me if there's anything else that I should know about that. Because one person was concerned that the oils, having essential oils in a home could negate the effects of the homeopathic remedies that were being used. So sometimes it's suggested not to diffuse, apply, or ingest for 12 to 24 hours before or after administration. But I also know some that are trained in veterinary homeopathy that use essential oils at the same time. So again, I would have to defer to someone else on that. I have a couple of homeopathic remedies that I use in my practice, but again, I use them on direction of my friend who is also a certified veterinary homeopath. So again, can it be done? Most likely. Do what you're comfortable with. So, before, during, or after surgery, using, the benefit of relaxation with the oils, you can ease muscle tension, decrease pain, decrease that mental and physical fatigue. And sometimes that's just as much for us and for the staff in the clinic as well. We can reduce anxiety, improve memory, enhance sleep quality, because of course if we're well rested, we perform better, and we want to increase immune function and overall support homeostasis. We want that sympathetic, parasympathetic systems in balance. I put this study in here because I thought it was really cool. The scientists brutally prepared a water extract, dehydrated it, and then reconstituted it in vitro, looking for synergistic effects between the combination of antibiotics and plant extracts. And one of the Staph aureus isolates, it was a MRSA, and the big thing is that they found benefit, but the magnitude of inhibition was most in the MRSA strain. So that was, I think, very interesting, again, kind of showing that you can use essential oils along with some traditional medicine, kind of like what we just talked about in the last lecture. This is kind of an introduction into the next presentation. This horse had a lot of head trauma. It fell and slipped to the floor, hit its head on the floor, and that swelling didn't show up until the next day. And the owners had been, when that started happening, they had given it some bute one day, Banamine. They gave it bute right after it happened, and then when it started swelling, they gave it Banamine, but then it still wasn't helping until they added Copaiba. It was applied topically and given orally when they started hearing the horse gasping, and within 15 minutes, the throat latch, they put it around the throat latch, and within 15 minutes, it was comfortable enough to start eating hay. So it's just amazing, again, what we can do with our essential oils. So that's all I have. We have 5 minutes left. I think I did pretty good. Try to hurry up there a little bit. So anyway, thank you for your attention, and if you have any questions, I'll be happy to answer them.
We were talking some respiratory-related stuff. What about for aspiration pneumonia?
Aspiration pneumonia, the question is what about using for aspiration? Anything to help them breathe and clear, so that might be another place for hyssop. So your eucalyptus. Another one that I like to help clear and open up is Ravensara.
And is diffusing good for those kind of areas?
Is diffusing good for those? Yes. Yes, absolutely. And sometimes I'll actually put some on the throat area or on the chest area too, but my favorite for something like that would be actually using a water-based diffuser. Yes?
For the laryngeal paralysis that you had talked about using the hyssop, were you talking about just one night, or were you also, like you said, locally?
Yes, locally too. For laryngeal paralysis, using the acupuncture point and going across and down, absolutely. Yep. And I had another dog, of course he did. He liked everything expensive. He did really well with rose oil for laryngeal paralysis on that too. The frequency of the rose oil really obviously resonated with him. And when hyssop wasn't supporting him like we wanted, we let him choose. The owner was like, of course he likes the expensive one. Yes?
Can you share which company makes chiropractic about?
You'll have to come up here afterwards. I can tell you then. Thank you. Anybody else? Yes?
For the end points, do you use lavender oil or any other oil that is used for?
Pick an oil. What might work for one may not work for another. But lavender, sometimes orange. Orange is kind of like I had a fellow practitioner call orange like the Band-Aid oil for especially for emotions. So she likes to use orange a lot. Lime and vanilla. An Ocotea combination is another one that I use there. So some of these calming blends, that would be another place to use that point.
What is the last one that you mentioned?
There's some calming blends from
What's the name of the calming blend again?
I can tell you later. Yes. I'm sorry, I can't hear you.
Do you recommend for cats that won't use
Diffusing for cats?
yeah,
I'm sorry, I can't.
cats that don't eat?
Oh, for animals that don't eat? Okay, either orange or spearmint. If you have an animal that doesn't have a good appetite, you can try diffusing orange or spearmint. Okay, yes.
If you had an owner who got really into the oils and then they put them all over the animal and the animal was not responding well, is there a way that you can help them bathe that animal to get any of it off, or is it all in and that's it?
Okay, the question is if you have an owner that slathers the animal in oils. We've all seen that. And the animal now is not responding. How do we get those oils off? Okay, it's going to be a time frame. Yes, we want to bathe, but we're going to want to use a good soap, a soap that will. I mean, I have some favorite ones there that we'll use, but again, some of that is going to be dependent on how long those oils have been on there. I mean, if the coat is still really greasy, and again, that's just, I always tell people you don't want your animal to look like an oil slick. If your pet is coming in looking like an oil slick, we're doing something wrong on that. So we need to just shampoo them and get that off. I'm not a Dawn fan. I like to use some good, good quality shampoo. I mean, something without the sulfates and everything in it, if you got that. But again, just get some shampoo on them. I'm not a Dawn fan, but bathe them and get it off of them as much as you can on that. And depending on the oil, I know I had a gal call me frantic. I happened to answer the phone Saturday hours, and I was still there, and I answered the phone. You wonder why you do that sometimes. But she had went to put a bottle of oil. It was a blend for mussels, and she went to put it on the dog, and it was a Bernese mountain dog, so 75, 80-pound dog, and the cap and the orifice reducer came off, and like 15 mLs of this just went all over the dog, and she was mortified. She was panicking. She was out on the East Coast. I'm like, he'll be okay. He'll be okay. Just bathe the dog. He'll be fine. Just get it off of him. And I went to a conference a few months later, and I remember this. I was pointed out. They referred to me in the audience, and I stood up, kind of had to do the that's me wave thing. And after the meeting, this woman was like barreling towards me. I mean, she was coming over the seats and everything, and I'm just kind of like, oh my God, what's this woman doing? And it was her. She wanted to thank me. So it was pretty. When somebody's bailing over the seats trying to get to you after the lecture, it was like, oh my. But so if it's good quality oil, the animal should be fine. But again, you don't want them to be that covered with it. Okay. We still have time. I'm sorry? A couple more minutes. Okay, right here. For pulmonary hypertension and/or congestive heart failure. Okay, so again, this is another place where helichrysum is good for that. Helichrysum and heart is a good one. And then a lot of times I just like to keep them calm, so something like lavender. It can be pretty easy. The thing with the oils, the other thing that I have since learned is use what you got. The way the oils work with the body, remember, intention is huge. And so you might read in a text that, oh, you have to use this oil for that. But if you're in a crisis situation, use what you got. And remember that intention will help. The oils will do what the body needs. And that's what's really amazing when you see that happen. All right. Thank you so much. I appreciate everybody coming here. Thank you.